Okay, thank you all, and I think we need to give Jean Ann a special thanks because she's done a wonderful job with this last session, paying attention and summarizing, which is not easy, and then leading this discussion. Okay. So, as we get to the last few minutes of the workshop, I'd like to thank all of you who were here, and I'd like to just for a second refer back to that slide I showed you yesterday with our framework from our committee. So there's the blank one, and if we can see the next one, I think this is all the stuff we've talked about over the past day and a half, and the visual really does speak a lot and in very little words of what we've covered over the past day. And again, it just shows you all the encounters children birth to 5 have, the sources, the locations, the influences, and then all the strategies we've talked about over the past day and a half. And thanks to Jean Ann, we have key messages. And thanks to the panel, we have identified some gaps and a lot of opportunities. You know, and just to highlight some of those, and maybe you've all selected your favorite, longitudinal studies on tracking of dietary patterns, including SSB consumption, birth to 5. We don't know much. We don't know about the impact of SSBs on weight. Does it make a difference? Does it, when, how often? All those kinds of things. Little is known about the impact of marketing on kids on this age group's consumption and tracking of SSB. So there's the marketing issue is important. The family is the key, as we've all seen, and yet there's a lot of barriers, there's a lot of misperceptions, parent behaviors, parent beliefs that maybe get in the way and impact the source of sweetened beverages in the home. So nutrition education, how to best do it. Are we doing a good job? And we have the federal programs that take some of this on with WIC and CACFP, perhaps SNAP in the future, who knows? Again, reducing the barriers, the social norms around sweetened beverages, the healthcare provider visit. When you think about how often a pediatrician or family practice doc sees an infant starting at 1 week, 2 week, 2 months, 4 months, 9 months, 12 months, 18 months, a lot of opportunities that maybe are missed, as Dr. Daniels alluded to, in informing parents about appropriate choices for children's beverage consumption. And then also the whole issue around how do we maybe call fruit-flavored beverages something different. I thought that was fascinating in this last session that came up. And then the whole issue of finding a champion or someone with authentic representation of the different groups that we need to target these messages to, I thought was really interesting. So I think that probably all of you have thought about these things and are going to think about them more as you leave and find your own opportunities to keep this discussion going in the future. And remember, all of these things are going to be, all of our discussions and videos and PDFs are going to be up on the website within the next week, and the published document will be ready by the end of the year. So finally, I want to thank all of our speakers who've come from many places across the country to share with us their important messages about this topic. I want to thank all of you for coming and being online if you're online, because I think your discussions have really helped. And I thank you for helping us with this facilitated discussion and sending up your questions. I think that's really been a key to getting a lot covered in these sessions. So be on the lookout for the proceedings, and thank you all for coming, and I hope everyone has safe travels home. Thank you.